Another question I get asked all the time, especially from our neuropathy patients, is how does cannabis help with sleep, and what the recommendations are from us, of course, to help them with the sleep because of that, the nerve and everything like that. So.
Actually, well, I have COPD as well. There's a lot of medical issues with me. I'm not going to go into everything, but I mean, I also have COPD, and I have problems where I stop breathing in the middle of the night, things like that. Sometimes I wake up too from, I mean, I've been off work for a year because I was on dialysis, and I got a kidney transplant, and now I'm recovering, and I'm a couple months into recovery now, and it's right now all I'm allowed to do is lift 5 pounds. So when there's not a lot of exercise being done besides walking at this point. So, I wake up in the middle of the night. I wake up 12 times. I stare at the ceiling at 3 in the morning. So I started I started baking with cannabis. I started making my own cookies. And I would start with a cookie before bed. And, and within half an hour I'm asleep, and I'm only waking up maybe once after 6 or 7 hours to pee, and maybe I'll get to sleep in for a change. It's
so edibles.
Edibles help me sleep. Right. That for me, that's what helps. Edibles totally knock me out when I need it. Yeah. Right? Like, it's not one of those things where I'm just gonna have a cookie and go out in public and do some shopping and go interact with people. It's actually I use it for appetite at nighttime or first thing in the morning, because I have to eat being a diabetic, and I don't always have that appetite. So I go with the edibles in the morning, right? I use CBD in the morning when I wake up and before I go to bed, and I just take it with my gabapentin. I now no longer am dealing with harsh throbbing and harsh sharp pains, and when I deal with other aches or whatever, I can just smoke a little THC when I need it.
Have you think you're being able to reduce the gabapentin by using medical cannabis? Or enhance it, or how?
It's for me. It's one of those combination drugs. The gabapentin isn't enough on its own. Right. I need it with something else. And like I said before, I was on Percocets and hydromorphones and all sorts of things, but it wasn't targeting my pain instantaneously. Right. With CBD, it was like a preventative maintenance. I just got to make sure I take it in the morning before I go to bed. I just take 15 milligrams in the morning, 15 before bed, and that's it. And with the cookies too, by the way, I don't even have to eat them every night. Right. It's just one of those, some days, where you just where it's low activity, it's cold as heck outside. Maybe I take my dog for a 20-minute walk, and that was all the exercise I've had. I'm not going to be tired at night. Then I'll have a cookie. That'll help me sleep, right? I'll wake up, I'll do my routine, I'll brush my teeth, have my shower, take care of me, have some CBD, take my anti-rejection medication, and then it's time for breakfast, and then I move on with my day. And then it just make a ritual of it. And, my life is completely manageable today. Perfect. Because of it. Right?
Cool. And one question, of course, I have to ask this, because it's Bud and Herbs. What's your thoughts on the Bud and Herbs Sport Recovery 2 tabs with the CBDs?
Oh, I love them. They're perfect. Like I said, any CBD product, really, I would experiment with everything. There's all sorts of ways. But what I like about the chew tabs, it's the auto absorption rate, because it's 100% bioavailable. The tabs themselves, when you just chew them a couple times, leave them under your tongue to absorb. It hits you in the back of the jaw, you feel it, it's in you, it's doing its thing immediately. Same thing with the tinctures, you can adjust your dosage there. But for me, it was a lot easier just to do the chew tabs. I take so many pills every day. Tablets may work for you if that's your thing as well. But
everyone's different.
Everybody's different, man. Everybody's different. I kind of like the chew tab gummies, because it was just like taking like a chewable vitamin gummy for me, right? To be quite honest, it was just a super easy way of taking it. And I thought they tasted delicious. They're color coded too, so so they're pretty easy to identify on which ones are which. If you're having vision problems or whatever, like myself, I say, okay, yellow, okay, I know I'm getting 15 milligrams of CBD. Or if I have the green one, okay, I know it's 7.5. You can control your dosages. So, yeah, love it.
Cool. So, just in closing,
sure.
If there's anything that, with all your experience that you've had with cannabis and neuropathy, Is there anything that you would caution people with in regards to the cannabis?
Yeah, don't overdo it. Take your time with it.
Follow the basic
You know,
rules,
and
go slow, and
you know what? This isn't. I'm not saying this is a cure-all for everybody and everything in any sort of way, but in my life, it's done its miracle. I can speak from my own experience. I can speak for my fiance. It helps her through her lupus issues. So if any of you know what that's like, you can be able to relate. It helps me with my neuropathy. I just after 6 days of being in the hospital after my transplant for my kidney, I'm off of all hard painkillers, no opioids, no Tylenol, just my simple regimen of what I have to take to stay alive. That's all.
cool.
So it's been
There you
good,
go, folks.
Thank you.
Bud and Herb's continuing education.
Right on.
And for diabetic neuropathy. Thank you very much, Jerry.
Thanks, Joe.